Good morning. Now we're going to talk about some nutritional concepts. On completion of this chapter, you should be able to categorize vitamins as water soluble or fat soluble, list the vitamins and their sources, functions, signs of deficiency, and symptoms of overdose, describe common electrolytes and their normal blood chemistry values, identify vitamins by their name and letter, list minerals and their sources, functions, and signs of deficiency, identify a chemical symbol for each mineral, describe medical conditions that may require vitamins or mineral supplements. Explain the role of antioxidants in nutrition therapy. And describe how and why consumers should be more vigilant in the use of herbal products. The FDA uses U.S. recommended dietary allowances to develop daily values to help consumers compare the nutrient content of products. Proper dietary allowances of vitamins and minerals are necessary for the maintenance of good nutrition in an average healthy adult. Adequate intake, or AI, which is different than the AI we're used to now, is based on observed or experimentally determined estimates of nutrient intake by healthy people and used when data to calculate an RDA is insufficient. Tolerable upper intake level is the highest level of daily consumption that current data has shown to cause no side effects when used indefinitely without medical supervision. So under special circumstances, vitamins and mineral supplements are required for a person's optimal health and functioning. The following are indications for vitamin and mineral supplements. So inadequate diet. If someone experiences anorexia, weight reduction, illness, alcoholism, or poor eating habits, they may require supplemental vitamins and nutrients. Malabsorption syndrome, like chronic gastrointestinal disorders or surgery that results in chronic diarrhea. Increased nutrients, such as pregnancy and lactation. Also infants under 1 year of age, adolescents, older adults, and postmenopausal women, or a deficiency due to medication interaction, like a depletion of a mineral due to a medication side effect. Two different categories of vitamins. There's fat-soluble vitamins, like vitamins A, D, E, and K, and water-soluble vitamins, like vitamin B and C. So fat-soluble vitamins, some sources that we may find of these. Vitamin A is carotene of plants, dark leafy vegetables, fruits, oily saltwater fish, dairy products, and eggs. The function of vitamin A is to help with resistance to infection, proper visual function at night, normal growth and development of bones and soft tissue, maintenance of healthy epithelial tissue, healing of wounds, and reproduction. Signs of deficiency of vitamin A might be night blindness, slow growth, anorexia, weight loss, bone and teeth deformities, dry eyes and skin, pruritus, which is itching, and symptoms of overdose. So if someone is taking a vitamin A supplement and they're taking too much of it, they might be irritable, fatigued, headache, lethargic. They might have brittle nails, dry skin, nausea, jaundice even, joint pain, stunted growth, or insomnia. Our next fat-soluble vitamin, vitamin D. Vitamin D best comes from sunlight on the skin, can also come from fish oils, milk, and cereals that are fortified with vitamin D. So functions of vitamin D is the maintenance of normal nerves and muscles, regulating the absorption and metabolism of calcium and phosphorus for healthy bones and teeth, and is good for pregnancy and lactation. Signs of a deficiency can be poor tooth and bone structure, skeletal deformities, osteoporosis, osteomalacia, tetany. Symptoms of an overdose, however, a lot of people in the Northeast take vitamin D supplements because with our long winters, we have less less skin exposure outside to sunlight. So too much of that can cause nausea, muscle pain, bone pain, can actually cause kidney damage, kidney stone formation, heart rhythm abnormalities, hypercalcemia, and fetal disorders. Our next fat-soluble vitamin, vitamin E. So different sources of vitamin E, cereals, wheat germ, seeds, nuts, vegetable oils, eggs, meat, and poultry. Functions of vitamin E is for helping us with our normal metabolism, protects our tissues of our eyes, skin, liver, breasts, muscles, and lungs, protects red blood cells from damage, and decreases platelet clumping. The signs of a deficiency, though, um, they're not really firmly established. However, some of the following have been noticed, like premature infants show irritability and edema, hemolytic anemia, and adults may show weakness and abnormal lab values. But symptoms of overdose could be bleeding in patients who are vitamin K deficient or on any kind of oral anticoagulation. So if they're on an oral anticoagulation medication, um, they need to be a little bit more careful while taking vitamin E supplements. Then there's vitamin K. So vitamin K can be found in our green leafy vegetables, cabbage, vegetable oil, cheese, eggs, liver. The function of vitamin K is blood clotting. So signs of deficiency can be increased clotting time, petechiae and bruising, blood in the urine or stool. Symptoms of overdose are rare, um, but some signs might be hypersensitivity, toxicity in infants, jaundice, hemolytic anemia. That's our last fat-soluble vitamin. Now for water-soluble vitamins. We have vitamin B1, B2, and B6. So vitamin B1 sources, pork, beef, liver, oysters, yeast, beans, peas, collard greens, oranges. This provides and helps with normal function of the nervous system and the cardiovascular system. Signs of deficiency might include GI upsets, constipation, neuritis, mental disturbance, cardiovascular problems, muscle weakness. There are no known overdose symptoms. Vitamin B2. So this is found in milk, different meats, liver, green vegetables, cereal, enriched breads, and yeast. This aids in energy metabolism of glucose, fats, and amino acids. Signs of deficiency might be glossitis, photophobia, vision problems, itchy eyes, dermatitis, and rough skin, so eyes and skin. There are no symptoms of overdose. Vitamin B6. So this can be found in pork, beef, chicken, tuna, salmon, whole grain cereals, wheat germ, legumes, peanuts, soybeans, bananas, synthesis of amino acids, antibody production, maintenance of blood glucose levels. These are all the functions. Signs of deficiency might be anorexia, nausea, vomiting, dermatitis, neuritis, depression. Symptoms of an overdose. Now, too much B6 can cause seizures in newborns. Vitamin B12. This can be found in seafood, shellfish, meat, poultry, liver, eggs, milk, and cheese. Vitamin B12 assists with the synthesis of red blood cells and maintenance of the nervous system. So signs of deficiency might be nerve problems, muscle issues, mental problems, pernicious anemia. Next one, folic acid B9. This is found in organ meats, green leafy vegetables, avocados, beets, broccoli. This helps with the synthesis of red blood cells, leukocytes, our DNA formation, and RNA needed for normal growth and reproduction. Signs of deficiencies might include increased risk of neural tube defects, macrocytic and megablastic anemia, irritability, behavior disorders, and there's really no signs of overdose, symptoms of overdose. Then there's niacin, which is B3. This can be found in milk, eggs, poultry, legumes, nuts, green leafy vegetables. Functions of this vitamin is lipid metabolism and nerve functioning. Signs of deficiency, pellagra. Symptoms of overdose, headache, flushing, increased blood glucose and uric acid. When you are at a gas station and they have those 5-hour energy drinks and those little shots on the counter, if you look at those, they have quite a bit of niacin in them. And if you drink them too fast, they'll cause you to feel heat and flush right away. That's the niacin B3 that's causing that flush. Vitamin C. So this is found in all citrus fruits, cantaloupe, broccoli, tomato, Brussels sprouts, cabbage, and green peppers. It assists with the development of normal teeth, gums, and bones, prevention of scurvy, formation of collagen, healing of wounds, absorption of iron, antioxidants. So signs of deficiency can be scurvy, poor healing, muscle cramps and weakness, ulcerated gums and mouth, loose teeth, and capillary fragility like bruising. Symptoms of overdose, sometimes this can raise the uric acid level, can cause gout, GI distress, kidney stone formation, and rebound scurvy in newborns. Electrolytes. Electrolytes are minerals that have dissolved in bodily fluids and carry positive or negative electrical charges required for body activities. So common electrolytes are sodium, potassium, and chloride, and can be measured through blood samples. So electrolytes assist the body in the following ways: conduction of nerve impulses, beating of your heart, skeletal muscle contraction, absorption of nutrients through the GI tract, protein synthesis, energy production, and blood formation. Sodium is one of the most principal minerals in the extracellular body fluids. Sodium has numerous bodily functions and assists in maintaining homeostasis. Chloride is another principal mineral that's found in extracellular body fluids, and it assists with normal body functions. Potassium is a mineral found in cells that assists with acid-base fluid balance and heartbeat regulation. Normal ranges should be sodium 135 to 145 milliequivalents per liter, potassium 3.5 to 5.5 millimoles per liter, chloride 96 to 106 MEQs per liter. So sodium 135 to 145, potassium 3.5 to 5.5, and chloride 96 to 106. So we talk about these vitamins by their letters: vitamin A, vitamin B, vitamin C, vitamin D, E, and K. They do have names that identify them. So vitamin A is also retinol or beta carotene. Vitamin B1 is thiamine. Thiamine plays an important role in people with alcoholism who are in withdrawals to help prevent DTs, because thiamine will reduce their seizure thresholds, and also in prevention of Wernicke's encephalopathy. Vitamin B2 is riboflavin. Vitamin B3 is that niacin or niacinamide. Vitamin B6, pyridoxine. Vitamin B12, cobalamin, cobalamin, sorry. Vitamin C is absorbic acid. Vitamin D2, calciferol. Vitamin D3, cholecalciferol. Vitamin E, tocopherol. And vitamin K, phytonadione. So we talked about different sources of vitamins. Now we're going to talk about different sources of minerals. So this is our sodium, potassium, calcium, and so on. So sodium can be found in table salt, beef, eggs, milk, and cheese. It assists with maintaining fluid balance and blood and transmission of nerve impulses. So signs of deficiency can cause low blood pressure. Symptoms of overdose can cause high blood pressure and edema. Potassium. Potassium can be found in oranges, bananas, dried fruits, and tomatoes. Um, this helps with contraction of muscles, heartbeat regulation, transmission of nerve impulses, and maintaining fluid balance. Signs of a deficiency can be muscle weakness, cardiac arrhythmias, lethargy, mental confusion. Symptoms of overdose can be weakness and cardiac arrhythmias. Calcium. Calcium is found in milk, cheese, yogurt, sardines, salmon, and green vegetables, except spinach. This helps with development of bones and teeth, contraction of cardiac smooth and skeletal muscles, nerve conduction, and blood clotting. So signs of deficiency can be osteoporosis, osteomalacia, rickets in children, muscle pathology, heart disease, and increased clotting time. Symptoms of overdose can include kidney stones. Zinc can be found in liver, meat, oysters, poultry, fish, whole grain bread, and cereal. This assists with wound healing, mineralization of bones, insulin and glucose regulation, normal taste, and antioxidants. Signs of deficiency can be poor wound healing, reduced taste and perception, alcohol and glucose intolerance. Um, Symptoms of an overdose can be GI distress, copper deficiency, and extended use, or copper deficiency can happen with extended uses of high levels of zinc. Magnesium can be found in green vegetables and whole grains. This assists with the synthesis of ATP, or the adenosine triphosphate, transmission of nerve impulses, and relaxation of skeletal muscles. Signs of deficiency are imbalance and weakness, and the signs of overdose or diarrhea. Iron is found in meat, liver, eggs, poultry, spinach, dried fruits, dried beans, and prune juice. This helps with hemoglobin formation. Signs of deficiency, paleness, lethargy, air hunger, irregular heartbeat. Symptoms of overdose, lethargy, shock, vomiting, diarrhea, erosion of the GI tract or liver, and also kidney damage. Chloride can be found in table salt. It helps with gastric acidity, regulation of osmotic pressure, and the activation of salivary amylase, so their salivary production. Signs of deficiency can cause an imbalance in your gastric acidity and imbalance in blood pH. Symptoms of overdose or diarrhea. Iodine is found in freshwater shellfish and seafood, as well as iodized salts. It's a major component of thyroid hormones. It regulates the rate of metabolism, nerve and muscle function, and growth of skin and hair. Signs of deficiency can cause a goiter and hypothyroidism. Symptoms of overdose is an iodine goiter, hyperactive and enlarged goiter. Medical conditions that require vitamins and minerals. Some are administered orally or intravenously to treat various health conditions. Following are just some examples of how vitamins and minerals assist in the treatment of various medical conditions. So vitamin K is utilized for bleeding disorders caused by low concentration of vitamin K dependent blood clotting factors. Vitamin C is used as an antioxidant, and vitamin D is used for osteoporosis prevention. So the role of antioxidants in nutrition therapy. Antioxidants inhibit cell destruction and damaged or aging tissues caused by unstable molecules known as free radicals. The human body has developed an antioxidant system response that defends itself from the free radicals. Antioxidants fight against destructive effects and function in the prevention of free radical formation by binding to and neutralizing destructive substances before they damage the cells and tissues. So some antioxidant vitamins include vitamin C, vitamin E, and beta-carotene. Antioxidants minerals include copper, manganese, selenium, and zinc. Herbal remedies are still a very popular treatment plan for many individuals. It's important that you understand and are able to answer questions effectively and refer patients to reliable sources of information. When providing sources, be sure that the information is based on fact and not opinion. As a healthcare professional, you have the responsibility to caution your patients regarding the dangers in taking remedies that are not approved by the FDA, and especially the risk of possible interaction between natural products and prescription drugs. As healthcare professionals, it's important to provide warning to the patients and others who may seek advice regarding the dangers of taking products that have not been adequately tested. Consumers who decide to take products of expanding market for herbal and dietary supplements should do so with care. It's imperative that they consult with their physician regarding any health conditions that could compromise their health or interact adversely with medications they're taking. They should also be warned of the possibility of fraudulent products that lack quality control. Consumers should always read product labels, follow directions, and heed all warnings. They should pay close attention to the possible side effects, cautions, and interactions of each herbal or supplemental product and their ingredients. Thank you.